Thanks for joining me. Today, what I'd really like to talk about with you is how to use some really powerful tools when you're looking to select either a rehab, a long-term care facility, or somewhere for respite care. When I started doing this work, which was a while ago, almost 20 years ago, it was back in 2009, there was very little data available on these facilities. Now, nursing homes are required to report a lot of data to state agencies and federal agencies. But no one really looked at it or knew how to look at it. It took practice and time to figure it out. But I will say the last couple of years, CMS, which is the Centers for Medicare and Medicaid Services, has taken that data and turned it into an easily understandable product to practically help people in this universe, which is very helpful because the majority of my clients have no idea about nursing homes. They don't understand rehabs. They're usually very quick decisions. Most people wind up in a nursing home after they had their mom had a hospitalization and they went to rehab at a facility, and the way they got there was the social worker at the hospital gives them a list of facilities and says, well, where do you want them to go? And that's usually the first encounter anyone has with a nursing home. So what I want to do is go through some steps with a very powerful tool that you can use. Now, it doesn't guarantee good outcomes, but it'll at least get you on the right track. So what you have up on your screen is the Medicare.gov Care Compare website. So if you literally put into Google Medicare Care Compare, you will get there. And this is what you'll see. This happy woman here looking to pick a nursing home for her loved one. So we can see here over in the column, there's different types of facilities you can look up. And these are also helpful for any of these healthcare facilities, but today we're here to talk about nursing homes. So we're going to look at nursing homes, including rehab services. We're going to click on this. Now, this is going to give us a location and a name of facility. So you can pick by zip code, you can pick by city, you can pick by state. And so what I'm going to do today is I'm going to pick by state, and we're going to look at a facility I just recently did some research on. So I'm going to put in New Jersey, and it comes up, and I'm going to use their entry in the drop-down menu. And this is a facility I was looking at. Now, generally speaking, if you want to just know around you, you can just put in, say, for example, where my old office was, Ewing, New Jersey. And if you don't know that area, you can click search, and it'll give you all the facilities in a 25-mile radius of that particular location. And we're going to discuss this star rating in a minute. So you can see here there's facilities that are listed, and they're by distance from that location. So you can see it's 0.5 miles for the first one, 0.5 miles for the second one, 2.3 miles for the third one. So let's take a look at this third one. This facility has a red hand. Okay, that's not a hand that's waving you in. That's saying be careful, because you can click on it and it indicates this nursing home has been cited for abuse. And for more information, follow the consumer link at the bottom of the page. So if you see that, that's something you certainly want to pay attention to. Not that, and there you can actually get the information. So it may be something minor, it may be something not minor. So at the end of the day, though, that red hand is a caution to be careful of. Now, this particular facility, you can see has an overall rating of 2 stars. Now, the way that's derived is combining the data from 3 sources you can see here below: health inspections, staffing, and quality measures. These are important to CMS, and they should be important to consumers. So first, we're going to look at the health inspection section. When we click on the button here, it tells us about the last inspection and how many citations they got. And you can see it's 34. And you can actually click on the link and get the full report. And there it is. This is the actual document that the facility has in their possession. And I'm going to make it bigger. It gives you a complaint number, and it's very specific about what happened. And that's why I say that just simply having a red hand, you want to know why they got it. And so understanding that, you can derive from these surveys. They're going to give you very specific information about that facility. Now, these documents we're looking at here are public record. The nursing home should have a copy of their recent surveys available to the public, usually in the lobby. And I will tell you this, if you're visiting a nursing home and they won't share that with you, that's a major, major problem. A, it's a foul, but B, why won't you show me your last survey? Because they're public record and they're required to have a copy of them for the public's inspection. And so you can see here that this is page 1 of 106. So this is a long survey, and it will go through all the issues that they found in the last inspection. Okay. So health inspection ratings are really important. They'll also give you the average number of survey citations in the United States and in New Jersey. So this place had 34. The average for the US is 9.6, and the average for New Jersey is 8.7. So they'll let you know how does that rank up, because most people, if you're listening to this, have never even heard the phrase nursing home survey. So how would you know if 34 is good or bad? They're going to tell you right here. So let's move on to the next category, that is staffing. The staffing is based on a formula that comes from daily staffing patterns that are supplied to Medicare on a quarterly basis. So they take that staffing data and they're going to turn it around into something that a consumer can use. And you can see here, there are 2 out of 5 stars. I should say that the 2 out of 5 stars is indicated as below average. 1 is well below average. 3 is average. 4 is above average. And 5 is well above average. So we can see here, they give you the typical census per day, like how many residents are in the building, and they're going to start giving you the hours. So the total number of nurse staff hours per resident per day for this facility was 2 hours and 56 minutes. The national average is 3 hours and 53 minutes. And the New Jersey average is 3 hours and 51 minutes. So you can see that they're coming in almost an hour below state and national averages. They give you the number of RN minutes per day. You can see here they're at 17, and the New Jersey average and the national average are the same at 41 minutes. You can see for licensed practical nurses, they're at 56 minutes, which is on par with the averages. But keep in mind, licensed practical nurses in New Jersey cannot do assessments, and they also cannot draft care plans. So they can really just collect data. So really, the registered nurses are the key metric. And then, of course, it's the nurse aides, because the nurse aides have the most hands-on contact with the residents. So how do they shape up? Well, we can see here it's 1 hour and 42 minutes. The national average is 2 hours, 21 minutes, and the New Jersey average is 2 hours and 14 minutes. So you can see that they're providing CNAs with almost 40 minutes less per resident per day, and that's not insignificant. You can get a lot of work done in 40 minutes. So this data is what's all going to contribute to their star rating. Now, this is a new thing where they start putting on the weekend hours, because if you didn't know, care doesn't take a break on Friday and come back on Monday. So at the end of the day, understanding that their weekday hours are the same as their weekend hours is really important. And so CMS also knows that a lot of facilities will do less weekend hours than weekday hours, and also on holidays. So they actually take a look and make sure that their weekend hours are consistent with what they're providing during the week. And here we can see they're 2 hours and 25 minutes, but their average is 2 hours and 56 minutes. So they're coming in below their weekday averages. Now, they really have this section on RN staffing because, as I said earlier, RNs have an open scope of practice. That means they can pretty much do anything a nurse can do, whereas LPNs or LVNs, that's a licensed vocational nurse, is the title they use in other jurisdictions, is much more limited. I really don't care what jurisdiction you're in. Licensed practical nurses have a much more narrow scope of practice than an RN. So here they're going to look specifically at the RN minutes per day. And on the weekend, it's 11 minutes per resident, which is almost a third of the national and New Jersey average. So, and well below the weekday averages or the week average. So that's a concern. Now, they also put the staff turnover, right? Because it takes a lot to bring on a new employee and to train that employee and to get them up to speed on their residents. So turnover is something that can be problematic if you have high turnover. And they explain this under the turnover section. And you can see they give you their turnover was 65% versus the national averages and state averages. Okay. Now, the last is the quality measures. The quality measures, they came in at 5 stars. Quality measures are things that can happen in a nursing home that may be indicative of the quality of care that they're providing. Now, you can see they have both short stay and long stay. Short stay is rehab, long stay is people who reside there. This has limited data for their short stay quality measures, which means not enough data was available to calculate a star rating. They are mandated under regulations to provide data, so I'm not sure why this one shook out that way, but there you have it. Now, you should know the quality measures are self-reported. Typically, the staffing data is going to come from the payroll company. It literally comes from data called payroll-based journal. The quality measures are coming from the facility directly. I will tell you that I find a lot of issues in cases I do where they are not reporting accurate data to CMS. So, in my opinion, the quality measures are an important metric, but they are subject to not being provided accurately. Whereas the health inspections, the State Department of Health is going to provide that information. The payroll-based journal data is going to come from the payroll company. This comes directly from the facility. So, but nevertheless, they do have a 5-star rating. And they will go on and explain the quality measure rating, and then you can actually look at the subcategories. So there's a lot of things in here. I'm not going to go through them all, but they're going to look at pressure injuries or bed sores, antipsychotics, falls with major injury, and those types of things that go on in the facility. They will give you how this facility shook out and the national and state averages. Okay. They're going to give you the safety inspections. They're going to give you if there are any penalties. So when you look at the penalties, you can see this particular facility received penalties in 2024 of $16,000 and $10,000. They'll also give you the ownership details. Now, in this instance, you can see the ownership type is for-profit corporation, and they will tell you who owns the facility. And you can get directions. Now, here's the consumer alert at the bottom. This explains the red hand. And that is this particular facility. So, like I said, this is for an area. Now, you can also do it by state. So if you know a specific facility, so for example, if there's one you want to look at that you know, so if you get that list from the social worker and you want to go look it up, you can just simply put in the state. This was one I had looked up recently, and it'll take you right to it. So instead of a radius or distance to a specific location, which is really good if you have no idea what you're doing. If you and you can also, I'll show you how to put filters on, but if you get the list from the social worker and you want to go look them up, this is the fastest way to do it. And so, again, they're going to give you the facility, the star ratings. I've explained what the red hand means and all that data that they have there. The one thing I didn't discuss earlier was when you have a facility that's part of a chain, you can actually look at the chain. So here you can see up in the upper right hand corner chain. You can click on that and it'll tell you the performance chain wide. So you can see how this facility's star rating goes across their entire chain and how they performed against other ones. And as I said, that's the fastest way to get the data when you have specific facilities you want to look at. You want to look at their star rating on staffing data, or you want to get their last health inspection. It's very easy to do that. As I said, I just put in the state and put in the name of the facility, and it comes right up. Now, it's important to note that this does not apply to assisted living facilities. And hospitals, as I said, are a different button you would click at the very beginning. This is just for nursing homes and rehab facilities. It does not encompass rehab hospitals, but nursing home rehabs. So if you're looking for assisted living facilities, you're out of luck with this. It's not going to help you. But if you are looking for long-term care placement, this is a great place to start. If I have families that I'm representing and they want to move their mom or their dad, this is usually the first site I point them to. Personally, I've had instances where family or friends were going into rehabs, and this was the first thing I looked at. So what I want to talk to you about now is just real quickly, let's go back to our original search. Ewing, New Jersey. How do you use a filter? Okay. You can see you can put a filter on for 25 miles, but you can also adjust that accordingly. You can look for, let's say you just say, I just want 5-star facilities. Well, you can do that. Okay. And you get all the 5-star facilities, right, within a 25-mile radius. Let's say you really want one for other ratings. I only want 5-star for staffing. You can get that, right? Now, it's also important to note this isn't just New Jersey. You can see this first place is Chandler All Health Services, which is over in Newtown, Pennsylvania. My office is very close to the river, and right over the river is Pennsylvania. So it's not limited just to the state. Even if you just put in New Jersey, or not New Jersey, but I just put in a city from New Jersey, it'll give me 25 miles outside the state as well. You can look for the certified number of beds. Like, let's say you want just a smaller facility, you could click that. And there you go. And there's more filters you can put on. Okay, folks. Well, I hope you found that helpful. The site's pretty intuitive. Once you get in there and you start clicking around, you can get it. Like I said, if you're not sure or you don't have any idea of the facilities in your area, you can put in your town and you will get the places within a 25-mile radius. If you get the list from the social worker, you can start going through them, just list the state, and then you can just list the facilities. They'll pop up in the drop-down menu and you can select them. Candidly, I hope this is helpful to keep a person out of my office or someone like me, that you can make the good choice at the beginning and get the outcome you hope for. So thanks for your time and attention today.